So as she lies down, you actually see that the scar doesn't really impact the abdomen at all. It's now not pinned in, it's nice and flat and smooth. It's an atrophic scar, so that nice white flat scar, which is lovely. The scar on this side, which you might not be able to see, the keyhole surgery scar, is also atrophic and it's white and flat. And of course, we've got the C-section here. Now, sometimes with clients, when they lay down, you can see the scar pinning in, you can see it pulling, you can see the tissues stretching. And what I'd always say is you assess around the scar. As women health physio, I'd normally assess the abdominal wall as well for diastasis. I'd normally possibly do the external pelvic floor check as well. But what I'm looking at is around the scar here. And what I'd say to all the professionals watching, have a look around the scar, document what the scar's doing, what it looks like. It's no fancy way, just say what you see and write it down. And then I would start manual techniques, sweeping my hands over the scar and feeling how that scar is pulling, because sometimes you come over here and you think, wow, that's super tight. I wonder if that's, you know, the scar is impacted in there. Or actually you start working around here and the client said, that's too much. That actually really hurts. Now, you'll find some manual therapists who don't have any oil on their hands. I love having oil and cream on my hands. And of course, I just find if you're going to moisturise the skin and the scar, you might as well have good oil and cream on your hands. So yes, so lots and lots of really nice light sweeping, and we call this feather light sweeping. And I would start to engage round that area. And then, of course, I might start to treat the scar. So pinning and pulling across the scar like so, circles across the scar like so, bracing and rubbing out like so.
And are you just being driven here by instinct, or
yes.
do you have a routine you go through?
No, not at all. Everything is holistic, so I never treat the same person the same. All of them are holistic treatments. And like we touched on before, once you understand how the scar is pulling, how it's restricting, I have clients that say, actually, the scar is fine, but actually it's up here. Right, you know what I'm going to do? I'm actually going to work underneath the ribs and I'm going to work on the diaphragm around here. I might do the same. I might do circles. I might do pinning and pulling. I might do bracing and rubbing over that scar. And what are we doing? I do believe we're influencing the tissues and creating that space underneath, creating that vasodilation, creating also a really nice endorphin response. So the client is more relaxed, less pain, how they interpret pain is different. So yes, and what I'm saying to therapists watching, I don't expect now you to start doing this with everyone's scars wherever they are on their body. But actually, even if it was just, okay, I'm going to make note of that scar, I feel it might be impacting your range of movement, it might be impacting your pain. Let me have a look to see how I'm going to start treating that scar. And I'm going to see if it makes a difference.